New research from Canada finds kids who live nearby public recreation areas, playgrounds, and sports fields are much more likely to walk to school or simply remain physically active in their free time. It may seem obvious, but experts say city planners may want to consider this when making urban improvements.
So, environment, having a park in your neighborhood makes you more, it increases the likelihood that you will be physically active. And as she said, it may be obvious, but if it's so obvious, then why don't we do that? If it's so obvious, why don't we put parks everywhere? Do we really understand how the environment influences our behavior? I'm not sure that we do understand completely, but we do know that it influences it. So, self-efficacy. Self-efficacy is, once again, and I said that we'll see it many times this semester, but it is the premier construct in social cognitive theory. And as we just discussed recently when we talked about self-efficacy theory, it's the confidence that you have in your personal capability to perform a behavior. It is the single most powerful predictor of behavior in social cognitive theory and in many instances in public health. Now, I want to talk about self-efficacy in a slightly different way. Situation-specific self-efficacy. So when we talked about self-efficacy, I asked you, would you be able to run 10 miles? And I asked you to report your self-efficacy. Now, let's talk just briefly about self-efficacy in overcoming impediments, or what we might call situation-specific self-efficacy. So if I were to ask you to report your self-efficacy for running 3 miles right now, and you might give me a number between 1 and 10, 10 being very high, 1 being low, and you might say I'm a 4 or a 5. Now, if I were to add in some situation-specific information, such as it's 5 o'clock in the morning, in January, it's very cold outside, it's snowing, and you stayed up late the night before studying for a test. Now, please rate your self-efficacy for running 3 miles. It's likely to be lower. Why? Well, because the environment or the situation has changed. And so self-efficacy can fluctuate based on the situation or the environment that we find ourselves in. And that's important to note. So just because we can change self-efficacy in one setting or one environment, it may not translate into all environments or all situations. That's important because many interventions will involve face-to-face counseling, perhaps in a clinical setting where we try to influence self-efficacy. So if I'm a physician, or I'm a tobacco cessation counselor or a health educator, and I have you as a client in front of me, I'm speaking to you, and I've gone through verbal persuasion, vicarious learning, and mastery experience, and sitting in my office or my clinical setting, you are comfortable that you're going to be able to reject peer pressure to smoke, or that you're going to be able to quit smoking, or that you're going to be able to be physically active, and your self-efficacy is high. That's great. But is that the situation or the environment that you're likely to find yourself in once you leave my office? Probably not. And so our focus should be on self-efficacy, situation-specific self-efficacy. Next, Bandura brings in, and while he calls this a construct, it's actually much more, I would think of it more as process-oriented. And it's the idea of goal setting. And goal setting is widely used in behavior change as a way to motivate the individual to engage in healthy related behaviors. And goal setting and monitoring our goals has become much easier with mobile devices now. So if you set a goal to eat 5 or more servings of fruits and vegetables a day, and historically you might have recorded that on a notepad, but things are becoming much easier, and now you can use an iPad or an iPhone or another mobile device. Next, Bandura, you may recall from self-efficacy theory, talked about emotional and somatic states as not being conducive to self-efficacy development. So when people are very emotionally distressed, they're not likely to be able to change their self-efficacy, or their self-efficacy is going to be lower. And so in response to that, Bandura introduces this idea of emotional coping as a construct of social cognitive theory. And these are techniques that we employ to control emotional and psychological states that may be associated with the acquisition of new behaviors. So, for example, we might teach people muscle relaxation, yoga, or other sorts of strategies and techniques to reduce their stress, to reduce the emotional distress, such that they can engage in new healthy behaviors.